All right. Hi, everybody. My name is Dr. Ais Morrell. I am a physical therapist and holistic fitness coach. Today, I'm going to be teaching you how to naturally transform your body and health without pain. How can you lose weight, shrink your belly region, build muscle so that you get back that confidence in your body and health? How can you do this without surgery, starving yourself, spending hours and hours at the gym, burning out, suffering from aches and pains in your back, knees, hip, neck, or other just weird symptoms? At the end of this training, you'll know how to start and progress on your health and fitness journey safely so that you can finally get back that confidence in your body and health overall, and then keep it for the long term. The three biggest mistakes that led me to discovering my path to optimal health and body was not addressing the amount of tension in my body, not maximizing the use of my core and breath, and then not choosing the proper exercises. So if any of this at all resonates with you, you're definitely going to want to stay to the end because you're about to learn so much in this training. Here's what you're going to learn today. Step number 1, how to reduce tension so that you can move better. Step number 2, how to breathe and use your core so that you can control your body. And then step number 3, how to exercise properly so that you can get stronger, build more muscle, and then finally transform your body. Now, does this sound like you? Do you forget what it actually feels like to feel good? Think about it for a second. What does good feel like? Do you dream of being able to look good and feel good, but you're struggling with where to actually start? Have you stopped exercising due to pain and discomfort? Do you miss feeling like you did before you had kids? I know you love them, but sometimes you wish you can go back to that feeling like you did before you had your kids. Are you tired of feeling uncomfortable with your body after starting something and then stopping because it was just so unsustainable? And do you feel like you're going to be stuck here forever? Think about it. Think about any of these. Do any of these things resonate with you? Any of these or all of these? I want you to stop and think. Do you know what good even feels like? Did you know it's not normal to wake up with a headache or a stiff back? Or have simple tasks throughout the day hurt? Or feel completely wiped out after every workout? Or have pain during your workout? Or to have to take a whole week off due to that one hard workout that left you so sore that it hurt to sit on the toilet, bend down to pick up something off the floor, or even roll over in bed? Ugh, been there. But you want to know the truth? It is not your fault you've ended up here. What a lot of us have been taught is wrong, or there's big gaps that are missing. And then sometimes this one size fits all program may not be what's best for you. That is what you get with fitness apps, group exercise classes, and then even working with some personal trainers. They miss the small yet major things that contribute to the big picture, which is how you move at a deeper level, your lifestyle, your habits, your support system, and then your preferences and goals. All of these play into how you actually reach your goals. So, why would you guys want to listen to me? I have been exactly where you are and I know exactly how you feel. I wanted to be confident in my body, but I struggled with getting results that I wanted. I tried it all: yoga, expensive doctors, tests, visits, all of those. I was a cardio bunny. I did a lot of heavy lifting, low carb, massage. I was a vegetarian for a while. I tried some traditional physical therapy, orthotics, gluten free, dairy free, expensive supplements, everything that all the experts and gurus told me that I should be doing. But you want to know what really happened? I ended up with more things going wrong with my body, and nothing that I was doing was working, and I still couldn't figure out how to just look good and feel good at the same time. Before, I felt so uncomfortable with my body. I struggled with yo-yo dieting and excessive cardio. Then, when I thought I had the lifting thing down, I was eating well, and I finally had the body that I wanted, but at the same time, my body was going crazy. I had pain everywhere, I was nauseous, I was dizzy, and I was in this constant brain fog. And then after I finally reached my dream body without a restrictive diet, excessive exercises, and having pain. And this was all after having a baby. I finally made it to the point where I was able to look my best, look fire, and then feel good at the same time because I did not want to sacrifice how I felt for how I looked. My background: I am a doctor of physical therapy and certified strength and conditioning specialist. I've worked in the rehab setting for over 6 years and in the fitness setting for over 9 years. I've helped hundreds of people reach their health and fitness goals. I specialize in treating women with emphasis on treating the body as a whole from multiple manual physical therapy courses, cranial sacral, posture restoration, and biomechanics courses. I love to learn all things related to the body. I am an education junkie. I'm certified in dry needling, which gives me a comprehensive knowledge of the myofascial system and how all things in your body connect. I'm a mom of a beautiful, strong, smart little girl, and I love to eat, move, teach, and I truly love what I do. This is my life today. I finally took the path that gave me the freedom and the confidence in my appearance, my strength to feel good every day so that I could be the best version of myself, inside and out. I'm going to talk a little bit more about my story later. Meet May. May started working with me for a few sessions of physical therapy due to back pain that was limiting her health and fitness journey. After only a few sessions, her back pain was completely gone, and she started on a tailored workout program addressing why her back pain would flare up in the first place. This workout program was not only working on her mobility and her core strength, but building strength at the same time to help her with her health and fitness goals. Not only is her back pain gone, but her confidence is through the roof. She continues to work out on her own, and she continues to see progress every single day. She's seeing her stomach slim down, her glutes develop, and more tone in her body overall. You are here because you want to lose some weight, tone up, build muscle, tighten up, strengthen your core, maybe get back some shape in your body, feel better overall, meaning no aches and pains, more energy, less health issues, and just improve the quality of your life as you get a little bit older. And you want to just look good. Very important. All this is 100% possible if you do it correctly. But if you don't, you struggle, which might be why you're here right now. Next question. Are you actually ready to lose weight and build muscle? Most people are not ready to jump into a typical diet and exercise program. And then this is due to the traditional American lifestyle causing uncontrolled stress on our body. Most people are overstressed mentally, nutritionally, and from a movement perspective. What does this mean? I want to state that everything that I talk about is a spectrum. You may be better or worse in some areas than others. I am not just here to help you lose weight. Some of us may benefit from weight loss or body recomposition, which is reducing the amount of body fat that we have and then gaining more muscle mass. But first, what we need to do is reduce the amount of stress that our body is under so that our body doesn't take this concept of weight loss as more stress. More stress in the body can equate to poor metabolism, hormone dysfunction, stiffness, pain, reduced brain function, reduced sexual reproductive function, and the list can go on and on. This is why your caloric restriction had you dragging and a little bit irritable. This is why the heavy weights at the gym left you achy and eventually you start to plateau. This is even why when you thought you were doing everything right, your body hurts and mentally you just don't feel like you're all there. Now, what do I mean by stress? When I say stress, I'm talking about your nervous system being in this constant state of flight or fight. We need the ability to come out of this stress or flight or fight state. This stress can come from what/how we eat, how we move, and the things going on in our lives. And this is going to be a big one. From a nutrition perspective, we cannot live in a caloric deficit. Most of us are not eating enough, nor eating the proper types of food to nourish our body. Because of this, we're not getting the amount of food that we need to meet all of our energy needs, nor all of the nutrients all of our body systems need to work optimally. So you can't burn the food that you eat, build muscle, you can't think, and you can't fight off the bad stuff. From a movement perspective, because of our typical sedentary lifestyle, amount of screen time we have, footwear, living on the clock, and the actual amount of stress we're under, it will alter our underlying mechanics. If we're not moving like we're designed to move, other things in our body will compensate. Then your body doesn't function like it's supposed to, leading to tightness, pooch bellies, rounded shoulders, flat glutes, lack of muscle mass, aches and pains. And again, the list can continue to go on and on. Mentally, we have so much going on in our lives working, raising children, house chores, the world that we live in, and then just our overall habits. When we're stressed, this increases the stress hormone in our body called cortisol. Long-term stress or cortisol production will wreak havoc on your entire system. This can be that partial cause of your brain fog, your bloated belly, hormone issues, anxiety, and other weird things that we experience. From all that you've just learned right now, I want you to understand we need proper nutrition to fuel our body. We need the ability to move better. We also need the ability to come out of this stress state to heal, build, and then function at our best. And then to tie it all back to our body goals. All of this will allow us to heal and recover, which we need to be able to live for one, but also to build that lean muscle mass and get the body and health that we're striving for. My area of expertise is movement, so I'm going to talk to you about movement. But you cannot have good movement without looking at the body as a whole. This is where your habits and lifestyle and nutrition, they all come into play. There are so many things going on when you're trying to transform your body and health. And there's so much conflicting information out there, it's hard to know where to start or what should you be doing. So let me break it down for you. Like I said, my area of expertise is movement, so I'm going to talk to you about movement. But the purpose of talking about your habits and your nutrition was to let you know that everything works together. You can't have one without the other. This is where that term holistic comes into the picture, looking at your body and your system as a whole. My 3 first steps, I'm going to be showing you today how to transform your body and health without pain. Step number 1, how to reduce tension so that you can move better. Why do I need to reduce tension? Because we're so stressed and don't move so well, a lot of us will have this constant tension in certain areas of our body. This will limit our ability to move or our mobility. Then, when you start to exercise and you don't have the mobility to get into certain positions, your body's going to begin to compensate. Usually it's things like your back, your neck, your quads, your hip flexors, calves, lower butt, or maybe even your upper abs. At some point, you may start to notice pain or tightness in certain areas. Or you might start to notice that you're not getting as much muscle growth as you'd like despite your efforts. We need to reduce tension to move better overall to see these better results. This is why you feel exercises only in your back. This is why your quads are only sore after your workout, because you lack the mobility and you compensate with those areas that have so much tension. You have probably gone through life with limited mobility already, so you may have noticed you already have some problem areas. Think about it. Where do you feel hurt? Where do you feel stiff? In order to get you moving to do exercise, we need to make sure that you can actually move and you're able to move correctly. But what if I have good mobility? Think about it. Do you think you have good mobility? Is good mobility being able to touch your toes, squat all the way down, lift your arms all the way over your head? Is that you? Yes and no. Maybe you can do all those things, but they might be a compensation from the areas that don't move well. Typically, it's your spine, your pelvis, and your rib cage. These are where a lot of people lack good mobility and then control, which we're going to talk about later. We want the motion happening from everywhere, not just one area, like in this toe touch right here. This might be considered good mobility to a lot of people, but where is she getting the motion from? Is it coming all from her hamstrings, or is she using that motion from her spine, her rib cage, and her pelvis like she's supposed to? To get those areas to move better, we need to reduce tension in things like your back, your neck, your quads, your hips, your hip flexors, your calves, your lower butt, and your upper abs. On top of this, you may have noticed one side of your body moves a little bit differently than the other. That bad left knee, that bad right lower back. We are all naturally asymmetrical at a neurological, respiratory, muscular, and circulatory level. Each side of our body has specific functions that are equally as important. We are more left brain dominant, which controls the right side of our body, and we also have a bigger, stronger diaphragm on our right side, which biases us towards being on our right side. This asymmetry is not a bad thing in itself because it's 100% normal and natural. But when we add this stressful lifestyle on top of these natural asymmetries, this is where we start to compensate even further. And then, if not properly managed, it can become a problem. Again, that bad left knee or that bad right side lower back. Not only does poor movement and excessive tension affect your muscles, it'll affect your brain, your gut, your reproductive system, your cardiovascular system, your emotions, all of which can lead to weird symptoms that sometimes nobody can give you the answer to. When you can't move, every system in your body knows it. Hence, everything is connected. I'm not saying I can help you fix all of your problems, but a lot of the problems that you have can be due to poor movement strategies starting at your base, your spine, your pelvis, and your rib cage. This is something that was probably never addressed or just not addressed well. That and some of the habits that I was talking about previously. I'm going to talk to you about how you can improve your movement so all the systems in your body can work together harmoniously so that you can finally get the results that you want. Mistake number 1, stretching is what most people do to reduce tension in a muscle. Though you might find short-term relief with stretching, evidence shows that there's not much long-term effect with static stretching. Yes, we want to reduce the tension in the muscle so that we have the ability to move, but we also want results that stick. We need a more effective way at improving our mobility. Stretching is not always the answer. So, what can you do to reduce tension? Tip number 1, address stressors. Things that are going on in your life can impact the amount of tension in your muscles. Your job, your relationships, your food, lack of sleep. All of those can impact the amount of tension in your muscles. Do you work all day and never really get a chance to take a break? Every once in a while, get up, walk around a little bit, do something different just to distract yourself from the stressful tasks at work. Choose better food options, less processed, more whole foods, stay hydrated, and then make sure you're getting in enough protein throughout the day and that you're eating enough food throughout the day. You should also reflect on the people around you and how they make you feel. Do you ever notice that you feel more tense around certain people? Really think about it. I want you to make sure that you're getting 8 hours of sleep per night. I know this is hard for a lot of people, but running on 6 hours of sleep every night throughout the week and then trying to catch up on the weekends, it won't cut it. Make sure you're trying to get at least 8 hours of sleep per night every day. You address this will reduce so much tension in your body. Tip number 2, use techniques that help you reduce tension. Breath work, soft tissue work, mobility work that reflects gait. Gait means walking. Breathing is the base of everything. This is what tells your body it's safe. We'll talk about this a little bit later. Soft tissue work. This can be done by getting massage, doing a self massage, foam rolling, massage tools. This will help to down regulate some of the tissues, improve blood flow, and then help to reduce tension. Those two things that I just talked about were great, but you also want to do mobility work that reflects gait or walking. This helps your body remember these positions a little bit better so that the mobility gains stick. This is things like lunges, RDLs, and a few core exercises. This is one of the major components in all of my programs. Typical exercises performed in a highly specific way to help you improve your mobility. For example, this stagger stance RDL right here. I use this for ankle mobility, back mobility, pelvis mobility, hip mobility. Yes, all of that. If you focus on how to do it properly, it'll allow all of those areas to work together as they should so that your mobility gains actually stick. Tip number 3, don't forget to address why it is tight in the first place. We just talked about some things to help you reduce tension from those compensations, and then how lifestyle can affect your movement. But it's not just your lifestyle, it's your movement in total. When we do those movements that reflect walking, just like in the previous example, we address the whys. This can be a little bit difficult to do on your own because we are all so different. We all have such different structures, so you might be different from the next person. So an exercise your friend is doing may not be what's best for you. That and how you do it is going to be so important. We'll talk about this again a little bit later. Meet Aisa. This is me. I struggled with weight pretty much my entire life. I always just wanted to be as small as the other girls in school. I started dieting probably in like middle school, going to the gym in high school, started doing a ton of cardio. I was able to lose weight, but always gain it right back because what I was doing was so unsustainable. I started weightlifting in college, and then when I first started grad school, my body was the strongest and looked the best it ever had. But at that same time, everything in my body was going wrong. I got this random dizziness. I would get random jolts of pain in different spots of my body. I would get nauseous all the time. My brain was in a fog. I couldn't remember. I couldn't concentrate, which made it very hard for me to learn in school. I had frequent infections, and I had no clue why. I went to multiple different doctors, had a whole bunch of tests, blood work, ultrasound on my heart, MRIs, neurological testing. I was told I was fine. Maybe I have fibromyalgia or anxiety. In the nicest way, I was told to just deal with it, and I never really got a solution. And it was very scary for me at the time, especially in grad school, learning about all these different diagnoses, and I thought I was dying. At the time, I was weightlifting. I was eating healthy. I had 2 to 3 jobs. I was a full-time grad student. And wow, I had put my hormones through so much in the past with all these unhealthy habits that I developed. I really dug myself in a hole. So I dug and I dug deeper to learn more about these things and the whys behind it to fix myself. I learned more and more about nutrition, more about sleep, more about how the body moves at the deepest level, and then learned how all these systems in your body interact. And I worked at it. I changed up how I ate. I changed up my overall habits. I focused on improving things at my base. And this was all after having a baby. Right now, I'm about 2.5 years after having my daughter. I am 31 years old, and right now I feel the best and look the best I have ever in my entire life. And that was really due to changing up my habits, addressing my lifestyle, and then improving things at my base and then integrating this into a workout program that's highly specific towards me. Meet Jenny. Jenny has 2 under 2 while working from home. Both of her babies were C-section babies. She struggled with weight gain after back-to-back pregnancies and had some aches and pains from previous injuries. She tried a well-known workout app, but this made her back pain worse, and she had such a hard time keeping up. When working with me, she prioritized nutrition, learned how to calm down her nervous system, connected with her core, and she learned how to lift weights properly. She was patient and slowly progressed over time, even while managing working from home while having 2 young children. Her major concern was having accountability and having patience. She had a few hiccups along the way, but we've been able to stay consistent each step of the way so that she does not fall off. She learned to keep herself accountable and stay on track even when things are not perfect. Her back pain and foot pain are gone, and she continues to see progress every single day. Step number 2, how to breathe and use your core so that you can control your body. Our core and our breath are the base of everything. This connects our lower body to our upper body. This allows us to move safely, effectively, and have optimal function. Mistake number 2, improper use, poor exercise selection. Most people do not know how to use their core and breath. This is partially what leads to that lack of mobility that we were talking about before. Again, other factors, but this is a partial cause. It is not your fault. You probably were not taught any better. Traditional health education, or just lack of health education, and the typical American lifestyle usually results in poor core and breathing mechanics, which again results into that lack of mobility that we were just talking about. Tip number 4. I want you to skip everything you think you know about core training. I want you to take it all the way back to the basics. By basics, I mean learn how to use your core in simpler positions. Learn how to be comfortable using your breathing in simpler positions, like on your hands and knees, laying on your side, and on your back. Then you progress from there. When you breathe in, you should see expansion or everything get bigger and the movement happening from your abdomen, your back, your rib cage from the front and back, your sides, in all relatively equal directions. Again, when you inhale, everything should get bigger. All of those areas should get bigger. Then when you exhale, everything should get smaller. During this exhalation, you're using your deep core muscles to compress everything inward, starting from your lower belly, traveling all the way up to your rib cage. This breathing pattern is getting you to use your core at the deepest level. This is how you get that better motion and control from your rib cage, your spine, and your pelvis. Now, as you get better, you choose more difficult positions. And as you're able to breathe better in these more difficult positions, your core gets stronger and you gain more control of your body. Again, using that base, using that foundation at your pelvis, spine, and rib cage. In a perfect world, that's how we should be able to breathe. But due to the compensations that we talked about before, some of us will have degrees of tension that will limit our breathing excursion. We may breathe in excess in one area and have limitations in another. So why don't you right now pause this video and then look in the mirror and see where you breathe. Do you breathe a lot in through your neck? Do you breathe a lot in through your rib cage? Do you breathe a lot in through your belly? Do you have no motion coming in from your back? Just take a second, look and see how you're actually breathing. So based off of how you breathe, some positions might be better for you than others. This is going to be based off of how you move, where your tension is, and how your body decides to manage it. Again, I know, sometimes a little difficult to handle on your own. Meet Linda. Linda's a 72-year-old retired state officer. She struggled with back, neck, shoulder pain, and foot pain after a few serious injuries. She even ended up having to have surgery for her neck, but still ended up having some problems from her neck. She tried physical therapy and personal training, but still struggled with severe sciatic nerve flare-ups. Also, still had pain in her neck, her foot, and then this all resulted in her having to stop working out entirely. When I first started working with her, she was unable to exercise. She got tired after a flight of stairs, couldn't walk her dog too far, and had a hard time lifting things due to the weakness that she had. Me and Linda, we focused on eating. We focused on improving her mobility, improving her core, and then we started lifting weights. Today, she's working out, lifting weights, walking distances, taking 7 flights of stairs. Her back pain is gone. Her foot pain is improving day by day. She's able to do everything in her day without being limited due to pain, and her body continues to see progress every day. Step number 3, how to exercise properly so that you can get stronger, build more muscle, and then finally transform your body. Mistake number 3, finding an exercise program or general exercises and then just doing it with no regards to your form or body type. How many of you are guilty of this? Everybody's body is so different. You may not be able to move like the next person. Everyone has different aches, pains, compensations, and structures. Performing certain exercises may be counterproductive for you, or you might just need to hold off for a bit. Performing exercises optimally is so important in preventing injuries and then maximizing your results. Tip number 5, make sure you're choosing exercises that you're able to perform correctly. Doing them right comes first. Afterwards, you can progress from there. When you're doing your exercises, squatting, lunges, push-ups, deadlifts, you're using all the mobility in the core and the breathing that we just used previously, and then you're just applying it to exercises. Again, all that stuff that we were just talking about previously was the foundation to exercising, to lifting weights, to finally transforming your body. Don't be so quick to choose the most difficult exercise. Choose simpler movements, go in ranges that you're comfortable with good form. Then slowly progress from there. But what is good form? Think about it. What is good form? Did the trainer that you worked with said you had good form? That's going to depend on the person. It depends on your ability to move, like we just talked about in the beginning, and then your ability to use the core and the breathing in those activities. You might think you have good form, and it actually might look good to the naked eye. But if you don't have the mobility and the control of your body, the foundation that we just were talking about, that good form can just be one big old compensation. Again, which is why you don't see the results that you want, because you just end up compensating. To progress, your body takes time to progress. It will not happen overnight, though you might see small changes day to day, week to week. I want you to be kind to your body, listen to your body, and slowly progress. It is a process to transform your body and health naturally. There's no magic pill, it takes time. So just be patient with yourself. So we learned how to reduce tension, we learned how to use our core, and we learned to exercise properly. So, this exercising properly is what's going to help us build muscle to finally naturally transform our body. How can building muscle help me transform my body and health? Building muscle has so many benefits, I cannot even list them all right here. When you have more muscle on your body can handle so much more. You're able to move better, have less aches and pains, and you're able to sustain activities longer and then lift heavier things in your day to day or at the gym. Having muscle is literally a superpower. On top of that, increasing lean muscle mass or muscle increases your basal metabolic rate, meaning you burn more calories than you would with less muscle mass. It can help you burn more fat, help you maintain your weight, and give you a more toned appearance, all by just having some more muscle in your body. You can actually lose weight without significantly restricting your food intake. Ironically, the severely restricting diet have the opposite effect and make you lose muscle mass and all of its benefits. On top of the stress response of having a sustained amount of a caloric restriction and all the things that we talked about previously. It also increases your insulin sensitivity, which is important for a healthy metabolism. It makes your bones stronger, which is very important as you age. It slows the aging process and has so many positive impacts on your mental health. And I know what some of you are thinking, building muscle is going to make me bulky. Depending on how you train, that's going to give you your desired aesthetic. It can make you bulky if that's what you want. But again, it's just going to be a matter of how you do it. So meet Jamie. Jamie struggled with Hashimoto's after the birth of her 6-year-old. After having her baby, she went very hard into lifting, but had to stop due to her diagnosis, causing a whole bunch of other health issues. She tried a well-known workout app, but struggled with feeling her glutes, her core region, and developed some lower back pain as a result. That, and she wasn't seeing progress. She did seek out help from a functional nutritionist, then started working out with me. She focused on connecting with her core, tying in her core with her mobility work, and then progressed this into her lifting. Lunges, deadlifts, squats, all of those things. Working out from home was major for her, just to save her time because she's a busy mom, and as a busy mom, time is so valuable. Now she is deadlifting, has no more back pain, glutes are firing and developing, and she's finally starting to see her stomach tighten up, all while homeschooling her son. Here is what we covered today. Step number 1, how to reduce tension so that you can move. Step number 2, how to use your core and breath so that you can control your body. And then step number 3, how to exercise properly so that you can get stronger, build more muscle, recomp your body, and then finally transform your body and health. So let me ask you a question. Are you ready for the next chapter? Are you ready to put in the time, the effort, and the consistency to finally achieve all your goals? Because it is so possible. But you're not sure if you can make it happen on your own. This is a lot of information and there's a lot of gray areas. There's the nutrition, there's the habits, there's learning how to move, there's learning how to exercise. And that's finally how you achieve your goals. It's very hard to do on your own. And I totally get it, which is why I created something for you. This is not for you if you're looking for a magic pill. Magic pill doesn't exist. Or if you're the person who doesn't feel comfortable making the investment that can enhance your health and confidence. Or you want someone else to do everything for you and you're not really ready to commit. Or you believe your current methods are the best. However, this is perfect for you if you're a person that's willing to do whatever it takes to enhance the quality of your life. You're willing to make the necessary investments into yourself because you believe the results can truly enhance your life. And you want a better life and you're willing to take ownership in your health journey and committing to the process of changing. Introducing one-on-one holistic fitness coaching. Now, how does it work? It all depends on what works for you and only you. It is a comprehensive program that's tailored specifically towards you, your body, your goals, your lifestyle. In my signature system, we go through some of the things that we talked about today. In your assessment, we'll go over your habits, your goals, how you move, and your past struggles. We're going to work to reduce tension using breath work, active and passive mobility, and then self-taught tissue techniques. We're going to work to gain core control using core and breath work tied together, using exercises that are selected specifically for you. We're going to progress the range of motion using all those things that we talked about previously, using that foundation, and then we just make it harder over time. Then we progress to higher level movements, increasing the resistance, incorporating multiple body parts, just to make it harder over time so that you continue to build that muscle. And then again, over time, we progress and teach you independence. We slowly make things harder and then teach you what to look out for so that you're able to do it on your own. This is the process that I and then so many others have done to achieve the results naturally. Sounds amazing, right? What's included? Here's what you're going to receive when you enroll. You're going to receive a full assessment of your lifestyle. We're going to go over your specific lifestyle. Then we'll work to improve your long-term health habits, work on things little by little, and adjust as we go along. This is things like nutrition, sleep, morning and evening routines, warm-ups, cool-downs, daily tasks. All these things will impact how you move, feel, and function. I will help you with all of these strategies to help you positively influence your body and health to actually achieve the results that you're looking to get. You're going to get a total body and movement assessment to see how you move. And I will have you perform typical gym movements to see how you move and then what you might be limited in. This will help me determine which exercises are best for you and then what you're going to need to be working on when you're doing these exercises. This is my specialty. How you move shows me what's going on inside and at a deeper level. This is what you don't get with those one-size-fits-all programs. With your limitations, we perform exercises to help you move better and then modify some of the traditional movements so that you're able to do them without compensation. Over time, we improve your range, and then you just get stronger over time. You're going to have an in-app plan with two-way communication. Everything is made specifically for you, planned out on an app, so it's very easy for you to follow. You'll be walked through every single exercise like I'm standing right there next to you to point out what to do, what you need to look out for, where you're supposed to feel it, and then what you can do if you can't get it right, because that does happen, especially if you're just starting out. And I know you're going to have questions along the way. You're going to be able to communicate with me and send me videos of your exercises to make sure that you're performing them correctly. And then based off of how you're doing them, I'm able to give you feedback and then hold you accountable. And I want feedback of how you're doing. I want to see how you're doing these exercises, not just that you're doing them. The how you're doing them is going to give you the amazing results. And this is all new to the program. Like I said, everything is connected and we cannot have full transformation without nutrition. I will work with you to give you macro recommendations or help you learn how to organize your plate if you choose not to count macros, because not everybody wants to count calories. You'll also be provided information on how to realistically eat healthy to maximize your fitness goals. You'll have a sample shopping list which uses food to heal and fuel the body. You'll also have meal ideas that you're able to tweak based off of your liking to make sure that you're hitting all your goals while enjoying life at the same time. I will not make you starve yourself. I will not make you completely restrict everything that you love. I will not make you eat everything that you hate. It's all about finding the balance between health, your goals, and your preference. I also want to say that this is not to treat any medical disorders or eating disorders, so if you do have any conditions that need to be addressed, please seek out care from your medical provider or registered dietitian. Depending on your needs, check-ins are online, virtual, on-site, or concierge. I want to make sure that you're held accountable and make sure all of your questions are answered so that you know what to do at every step along the way. You'll also have access to all of the information on all your body questions. I want you to learn, not just do. You're going to be learning what I'm looking at so that you can understand how to do things on your own when I'm not there. The goal for you is to continue on your own and grow after we finish working together, so you continue to see results even after we finish the program. You'll also have additional add-ons based off of your needs, weekly calls, physical therapy services if you're in the state of Florida, and you also have the in-person option for workouts. So let me ask you a question. Which path are you going to take? Path number one, you're going to try to figure it out on your own, wasting time, money, energy, trying to put all the pieces together. Or path number two, you can finally get the support, guidance, and accountability that you need to succeed without any of the stress. But I know what some of you are thinking. I know what I'm doing. I don't need any help. Though you may have experience in fitness, I am positive I'm going to teach you specifics about your body that you don't even know about. This will help you build knowledge and confidence in yourself in a way you've never even thought about. I've tried physical therapy and personal training before. Not all PTs and personal trainers have equal knowledge. Everyone has extremely different backgrounds. Some people have gone through a weekend course. Some people have gone through years and years and years of school and have done a lot of continuing education. The amount of time and education I put into this craft to individualize every single program is something like you've never experienced. This is not a one size fits all program. This program is working with you from the inside out to ensure that long term success. I don't have the time. The thing about this program is you tell me what you have time for. Ideally, I would like a minimum commitment of 3 days a week, 60 minutes each time, and then each day with 10 minutes of recovery work. But we're able to adjust from person to person based off of your lifestyle. But there's always small things that you're going to be able to take out in your day to day just to get some extra movement in. If it's important to you, you will make time for it, even if it's 20 minutes a day. I've had so many clients that have been able to achieve amazing results with a very limited time. It's just a matter of how much you want it. I'm not ready to do something like this. I have so much going on. We are always going to have a whole bunch of things going on in our lives. This is when we need health and fitness the most. When we have a ton of things going on, this is when your health starts to decline. You get sick, you gain weight, you become injured, you get anxious and depressed. And then when you come out of this stress period, you have more things to come back from. You need to take care of yourself now more than ever in this time period. What if I told you this can help you manage this stressful period? Remember, this program is built specifically around your lifestyle to help you feel better in every way. So, yeah, you might not have much time right now, but when will you have time for it? When you've really dug yourself in a hole? Really think about it. Is it worth it? I don't have the money. I understand a lot of us are going through some really tough times right now. So, we offer payment plans for those that may need it, but it is so imperative that we address things now rather than later. When you put things off, they get worse and worse. They take longer to address. They become more expensive, more stressful, and then harder to address. For example, doctor's visits, physical therapy visits, your supplement graveyard. How many supplements do you got in your cabinet right now? Personal trainers, medications, and then if it really comes down to it, surgeries. All of these things add up when you let them go on. Prevention and early intervention is key. That, and I've seen so many times where those expensive tests, doctor visits, personal trainers, surgeries, they don't end up doing anything because they never address the root cause of the issue. That and the fact is, a lot of them, they just don't care about you. I only work with a small amount of clients to ensure that you reach all of your goals and that you are not a number and that you are cared about along the way. I don't think this could work. It can and it will if you're committed. It has worked for so many others that were stuck in the same position as you. And the results of this program are guaranteed. If you don't notice noticeable changes in your body and how you look and feel, I will work with you till you do. Your success is my success. So connect the body that's with holistic fitness. Here is everything one more time. You get a total body movement assessment, full assessment of your lifestyle and habits, in-app plan with two-way communication, a video walkthrough of every single exercise, virtual, in-app, or in-person check-ins, and then you also have access to all of the information on all of your body needs, all in a program that's made specifically for you. If you're interested in this program, I will have you book your consultation call. The link will be below this video in the show notes, or it's going to be emailed to you. I also have something very special for you guys. If you'd like something that you're able to do right now on your own at an affordable rate, I have my Optimal Mobility and Function program. This provides you all the tools to do it on your own. It's a 12-week self-paced course of every single thing that I talked about, but at your own pace. You get a self-movement screen, education on your body and what to look out for, nutrition information, sample shopping lists, self-massage techniques, tips on managing your stress and habits, exercise progressions, video walkthrough of every single exercise. Also have access to our Facebook community of people in the same journey as you, where you can get all of your questions answered along the way. This is all for $49 per month for 3 months. And what if I need more help? If you're looking for a treatment for a specific injury, addressing the root cause of your problem, physical therapy is provided in the state of Florida. I also want to state that my holistic fitness coaching and optimal mobility program are not to treat any particular diagnosis. It can help you train around these conditions, which can in turn improve your underlying mechanics and symptoms. But if you're looking for a treatment for a specific injury, addressing the root cause of your problem, physical therapy services are provided in the state of Florida. I use manual techniques such as soft tissue mobilizations, dry needling, joint mobilizations to reduce tension and address movement dysfunction. Then I progress you into a tailored exercise program so you don't have to keep coming back. This is a highly customized specific plan, so I'd like you to book a call if you're interested in this service. Unfortunately, due to the complexity of this treatment, insurance is not accepted. If you still have any questions, you can email me at aisa@connectthebody.com, or you can go to my website at connectthebody.com. You can follow me on Instagram at draisa_. I post a lot of tips and tricks on all the things that I just talked about earlier today. And I really want to thank you guys for watching this entire video, and I hope you guys learned something. If you did learn something or you do have any other questions, you could still reach out to me on Instagram. I love getting feedback based off of like all the things that I post and stuff and answering other questions that you guys have. So again, thanks for watching, and I'll see you guys next time. Bye.